Each pregnancy and delivery experience is unique. That's why there are many ways to address pain during labor, like warm baths and pain medication. If you're especially uncomfortable, you may choose to have an epidural. An epidural is a safe and effective option to provide pain relief from contractions during labor. It blocks pain sensations from your waistline down through your legs. This is where most pain is felt during contractions in childbirth. Epidurals allow you to be awake and fully participate in the delivery of your baby by reducing the intensity of your labor pains. Epidural placement involves insertion of a plastic catheter in the space between the bones of the spine. The catheter is introduced into the epidural space through a hollow tube. The hollow tube is then removed and the catheter remains throughout labor and delivery. Medications are pumped through the catheter continuously until after delivery, when the catheter is removed. It usually takes only a few minutes to place an epidural catheter, but finding the proper location may take more time depending on patient anatomy and weight. Proper patient body position is the most important component in placing an epidural effectively and efficiently. Both the nurse and anesthesiologist can direct and assist you during this process. You will begin by sitting up straight on the edge of the bed, like sitting on a park bench with your feet and legs over the edge of the bed. Next, relax your shoulders and arch the lower part of your back out like the arch of a rainbow. The anesthesiologist will perform the procedure between contractions. However, there are times where they will continue through the contraction during your labor. Once the epidural catheter is secured to your skin, the dose of medication will be injected, followed by a continuous infusion to keep you comfortable during your labor and delivery. You may not be allowed out of bed once the epidural catheter has been inserted. You may sometimes be encouraged to reposition from one side to the other. If a cesarean section becomes necessary, different medication can be inserted through the same epidural catheter. Following delivery of your baby, removal of the epidural catheter is a relatively simple procedure. We'll simply expose your back and the tape along with the catheter will be removed. Again, having an epidural is a common and safe technique. However, as with any medical procedure, there are risks. Headache. Should a headache occur, there are many conservative measures that can be used along with an epidural blood patch if needed. Back discomfort. Most back pain occurs because of your labor and delivery, and it is very unlikely that an epidural would worsen this discomfort. Infection. The epidural procedure is a sterile treatment, and the risk for infection is very low. Nerve sensation. A funny bone-like feeling is possible, but permanent nerve damage resulting in paralysis is very low. Bleeding. The risk of bleeding is low as long as you do not have a bleeding disorder and are not taking an anticoagulant medication.
Epidurals have been proven to be safe and very effective. However, just like with any medical intervention, there are risks associated with having an epidural placed. One of the risks is a drop in your blood pressure. Therefore, the nurse will administer intravenous fluid to reduce the intensity of your blood pressure drop. The epidural, once it's placed, will have a continuous infusion of local anesthetic medication running during your entire labor and delivery process. However, it's very common that the second stage of labor you may notice increase in pressure sensations during the passage of the baby through the birth canal. This is normal and to be expected. It does not mean that the epidural catheter has ceased functioning. Following delivery of your baby, we will turn the infusion pump off and eventually remove the catheter. However, the effectiveness of the local anesthetic may linger for a few hours after the catheter has been removed, but nothing discernible by you. Typically, the epidural has no negative effect on the progress of labor. However, if the epidural catheter is placed early during the process of labor and delivery, it may have minor effects. And if that should occur, orders for Pitocin will be administered to allow for uterine contraction and continue the progress of labor. Once the epidural catheter has been placed, you will not be permitted out of bed. When it becomes necessary, the nurse will place a catheter to empty your bladder. We will initiate an injection of local anesthetic, and over about the next 20 to 30 minutes, the intensity of your contractions will be gradually decreased. The infusion pump will, however, continue throughout the duration of your labor and delivery, and it's also not unusual for moms to want to just rest a little bit now that they're feeling a little more comfortable in preparation for the delivery of their baby. The effectiveness of an epidural should not have a negative influence on the progress of labor. You'll still maintain those same sensations of pressure when it comes time to push. The chances of paralysis or nerve damage occurring from placement of an epidural catheter is extremely unlikely.
Whether to have an epidural is an important decision when planning your labor and delivery. If you have additional questions or concerns about the epidural, talk with your OBGYN to help make the right decision for you.